Hello everyone, I hope you all are safe and well with your families. We are still in COVID crisis, so I hope and pray this gets over soon and we get to go back to the normal life. I do miss actually my clinics and all my clients, so wherever you are, just stay safe. So today we're going to talk about living with acne. This is episode 5. Just a bit of a recap that in the previous episodes, they all are available on the page. We have discussed about what acne is, what are the triggers for acne, what you can do at home, when is the right time to see your GP or a doctor, and when do you need to be seen by a dermatologist. Last episode, thank you so much for sending so many comments and appreciating it. That was mainly about the mental health and acne. Mental health is one of the biggest problem nowadays. I think it's not just only So I think it's not just only related with acne, but it's related with most of the skin conditions and many other psychiatric conditions as well. So it's like a bit of a cycle. So the reason for me to discuss habit reversal today is because of the demand of most of the people who have watched the video last time. So we just need to know what it is, how we can use it at home, or how it can help us. So in terms of habit reversal, as the name says, it is one of a multi-component behavioral thing. It's like a bit of a package rather than just on its own. Hi Sunny, and hi Rachel. So it's not a substitute. We're not substituting a treatment. It's just a complementary thing. So which means that habit reversal is one of the crucial element of a treatment. It was first introduced in 1980s by one of the consultant psychiatrists who was based in London. And the main reason for that was many other conditions like obsessive compulsive disorders, or anxiety, depression, or a situation where people have impulsive thoughts, and those thoughts were kind of affecting their body, and they were doing the repetitive movements without realizing to harm themselves, thinking that this is just their body and it's not going to affect somebody else. So that was a bit of an idea how it kind of emerged. The different steps involved in habit reversal. And as the name says, I think it's very simple to understand that we do develop different habits in life, sometimes purposely, sometimes unintentionally. And any habit which is actually going to create a negative circle in your body will stimulate the negative impulse in your brain. And that is then going to fire at higher speed. Something which we did discuss last time in neuro-linguistic approach techniques. Now, in one of the coming episodes, I will discuss more about neuro-linguistic approach, because apparently it seems like that it's a very interesting topic, and many clients who have sent me messages, they felt that that was something they needed to know a bit more. So let's come back to habit reversal. As I've mentioned, it's a multi-component technique. So what exactly it does? If we divide that into different steps, then the first and the most important step is to recognize, to know, to have awareness, first of all, that what is the habit and why do you need to know about it? And then secondly, once you've kind of identified it, then it tries to discipline you. And then we put different steps, different kind of methods. And sometimes psychological input is really important as well. And sometimes people can do it at home. There's so many exercises, self-reference things present online. I can always share the resources centers here as well. Now, psychodermatology is one of a big field of dermatology. And I see so many patients, as I've mentioned in all of my other episodes as well, that you can't deal with skin if you don't know what's happening in the brain. And one of the most interesting thing is that going through that when you talk about the mental health, it also helps you to understand that is the skin only a problem at the surface, and what exactly is brewing underneath. So another condition which is very common, like body dysmorphia, where you have a lot of perception about your appearance. And whatever you try to do, you can't satisfy because the concepts and the brain signals are working in a different manner. So that's why taking a detailed mental health history is really important. So let's again focus on what we do. So usually the habit reversal, we divide that into two parts. One is called awareness training, and second is the behavioral training. So in awareness training, what you do is that you kind of go through and you explain to the patient or your client what exactly awareness means. You try to kind of understand the root cause. What is it which is making them to pick a spot or their skin? One of the major reasons for the habit reversal in dermatology was actually to cover or to help with the itch-scratch cycle, which is one of the biggest problem in many skin conditions like eczema, even psoriasis, urticaria, or you name a condition. So it's the concept is similar, which we use in acne. So most of the time people feel that there are many blemishes on the face or simple spots, and because it does not look good, and they start picking up. So the first in awareness technique, we need to know how often they're doing it. What is it? What is the kind of factor which is driving them to pick the spot? And sometimes, yes, you can't figure out. It's very difficult for client even to know because it's a habit they've developed and it's a reflex action. And reflex action is similar, like when, say, for example, your body touches a hot object without realizing, without thinking. The reflex action is so strong because there is no second thought linked with it that automatically your hand withdraws from that stimulus. So in habits, you actually develop similar reflex actions and you practice it on daily basis. That's why a repetitive pattern develops. So then we need to know that the second thing, most important thing is what are the precipitating factors for them? Does that happen when they're alone, or does that happen when they are with somebody? If they have underlying mental health conditions, anxiety, depression, low mood, or bipolar disorders, does that make it worse? And how do they feel? Does that make them feel better? Sometimes people have a guilty feeling, how they look, and they do a repetitive movement, and after that they have an intense feeling of calm and comfort. So it's very important to know, because if this is what it is, then these are the patients or the clients. They need a proper psychological support, a multidisciplinary team approach, and explaining yourself to them does not usually work. We have a biggest center of psychodermatology in London, and we refer so many clients with this situation to them. Then it's also important to know that if they are waiting, or if they are going into either a wedding is planned, or there is an event happening in their life and they're not sure, and they feel that nothing else is working, and they are actually trying to facilitate the process of healing rather than making it worse. So it's a clarity of the thoughts which we need to know. So once we kind of put all of this, we also need to go through the emotional triggers, work, job, what is it, and how often they look after the skin, and what are the skin goals. So again, somebody with the body dysmorphia, the skin goals are very different as compared to somebody maybe with subtle anxiety or depression, or with acne. So it's important to kind of differentiate it. Also, most of the time, once you kind of go through an awareness strategy with them, it's important to know that I usually tend to ask most of my clients, just talk me through the process, that you're sat at home or you're in a different situation, what happens, what triggers you, and what do you feel, and all of that. So once you've done, it's also important for you to know that do these patients need antidepressants, or they need other support. So cognitive behavioral therapy, something what we call CBT, is a biggest element of habit reversal. So they can refer, most of them in England, they can refer, it's a self-referral. Mind Matters, they can go online and refer themselves. Usually somebody gives them a call and triage them, and based on that, they can make an assessment. But there is a very long waiting process, so that's really important for you to consider. If you feel that talking therapy is not for them, which about, I think 50% people, they don't feel to go through the same process and discuss with their doctors or see new faces, because it's quite difficult. So imagine if it's me and I go through what is happening in my head, and then I see another person going through the same thing. It does actually knock a lot of your confidence out, and you feel sometimes it's a cycle. Am I just going to explain without having appropriate discussion or treatment? So that's what is the concept of awareness. If you fail to create that awareness circle, it's very difficult for you to move on to the second part, which is the behavioral therapy. Because if somebody has no kind of no awareness and they feel this is not which exist, you can't ask them to change it. So that's really important, and that's where the neuro-linguistic and CBTs and all of these things, they kick in. Now in the behavioral modification stage, I mean, the different steps, like 5 and 10 steps which are involved, but just to kind of make it simple. So in the behavioral modification stage, we usually give them some worksheets to work, and they go through and they explore it further. So in exploring that, they actually form a plan for themselves as well, and then how they wish to engage in the treatment. So the whole idea is that when we do that, we just have to create the new strategies for them, and we have to sorry, just one second, and we have to create a new planning for them. When we do that, again, then you can use anything. So sometimes, like, I do a lot of my special interest in dermatology is pediatric derm and skin cancers and other. But when I'm sat in my clinic dealing with acne, which is like every day I see that, especially with the children to adults, sometimes it varies. I personally feel the children, they tend to listen to you faster, and sometimes when you give them these tasks, they actually take it religiously, and their outcome is far better. I think this is mainly because when we age, we become more rigid and we feel that we are right, and that is a very important concept with habit breaking. So in multidisciplinary teams, if you feel that this is not right, so sometimes as a dermatologist, we do prescribe antidepressants to the patients, or you can ask, you can refer them to see the GP, and they can then refer it, further on. So in different steps, which are very common and which patients usually feel very easy to do at home, as I've mentioned last time, is about a bracelet technique. And they can make it, they can, and sometimes that engage themselves. So the whole idea is that they are actually buying some time to fight that impulsive thought. And that thought could be for seconds or sometimes for minutes. Usually that thought is not for hours. So if you kind of formulate a plan where they feel that they can cover and distract themselves for the initial bit, it actually works better later on as well. So children, they love to make bracelets. Parents, I usually ask them to get reward charts. You can do it for yourself as well. Sorry, I'm just reading the questions which are coming at the same time. So you can then you can actually ask them to buy the reward charts. And one of the most important thing is that it's because they have built this over years or sometimes months. So we're not expecting the habit reversal within a day. So that's really important concept. So the teenagers or clients, when you see, or your relatives or anybody, you just have to give them some time. And if whatever they have agreed on or they have made a short-term or a long-term plan, like I am a big believer of a short-term plan as well. So I just tell them that what do you think and is realistic for you. So sometimes if they're saying, well, within 6 months, we think we will reverse that. So I say, perfectly fine. Let's further skim it down. And they can make maybe a 4-week plan. They can make a 1-week plan. And sometimes I make even 3 days plan. A short-term plan, when they do it, it actually helps them because they achieve something. And if you see that human mind is set not only to get criticism all the time, but it behaves better and well when you appreciate it. So when you encourage these patients and you kind of praise them, it actually works quite well, but you have to tell them to encourage themselves as well. So for example, if somebody has got 5 spots or they feel scratching 10 areas, if they can get rid of, if they do next day, maybe they pick up 3 spots, I'm very happy, because we have already achieved something. So you have to tell them it does not mean that they have to stop and the outcome next day will be 0. It does not work. So when that happens, I tell them to kind of treat themselves and to tell themselves they're doing really well, and then write it down. So if it's a child then or a teenager, then parents usually help, and they can buy them you know, a bit of some gifts or anything, or you can go out for like you can create anything you want to. So the whole idea is that you need to give this buzz feeling to your brain that you are doing really well, and you are progressing in this as well. So I think this is nearly what it is. Sometimes a few of the techniques which I did, yes, the other thing, sorry, was that somebody asked me about the watch technique. Now, this is one of the new neuro-linguistic approach. I do it a lot. I'm not wearing a watch at the moment, but it's very simple. And you can use it to cover any bad habit or anything. Or in a situation of stress or anxiety, you can buy some time for yourself. So what I do is, if you have a watch or if you have a clock right in front of you, you see the second needle. So you just try and focus on that. So and you buy 1 minute for yourself. So 1 minute is enough because everything is you know, bouncing on you around, and you just need a small window to create a positive impulse. So when you're watching that 1 second needle which is moving on your watch, you're just trying and you're telling your brain, yes, fine, I know you're upset and I will listen to you, but just give me 1 second. And during that second, you're thinking something positive. So if on the same day you have popped 1 less spot, this is something positive you have done. Or you think about a relation, or you think about something, a good thought, which must have happened in your life, which has brought some positivity. And that is actually enough. So 1 small thought will try and break that cycle of negativity. Yes, initially it's like a bit of an amateur kind of a thing, so you need to work onto this, a repetitive pattern you have to develop. And then you may not need to look at the watch, and you can then filter a lot of your thoughts. So this is again one of the concept of CBT. It talks you through where you were, where you think you are, where you want to go, and what is the kind of more realistic plan we can make. So I think that's all. If there are any more questions related to habit reversal, please drop me a line and I'm very happy to talk about it. Thank you so much for watching, all of you, and stay safe until next week. So next week we're going to talk about acne scarring and what I do in my clinic and how we can work on that. So thank you so much again for watching, and I'll see you very soon. Bye.